Hi ladies and gentlemen, this is Fruhan Landman from Key Wealth, and in this video we're going to have a quick look at Pace 1, which is probably the flagship product of Bestmed, a wonderful option especially for someone that needs a lot of medical care or someone that's got a family with children. There's a lot of benefits here. Let's start to look at the premium. This is a comprehensive option, so it is slightly more expensive than what you might be used to at 4,620 Rand for an adult dependent, 1,166 for a child, and this is a great option for a single parent as well, because the premium ratio to benefits for a single parent is extremely high, so lots of benefits there. Please take note, you only pay for the first 3 children with Bestmed, so the 4th one is for free, so on the house. And then they say you pay the child dependent rates up to the age of 24 if they're not students, and up to 26 if they are students at a registered tertiary institution. This option is what we call a hybrid option. I'll get into the detail a little bit later, but just to be brief, there is your accommodation will be covered up to 100%. There's 7 days take-home medicine. Remember, you have to get this at the hospital's dispensary or the hospital pharmacy, and not a pharmacy at a hospital, if that makes sense. You do have a small limit for biological drugs during hospitalization. You've got your mental health, chemical and substance abuse, and then your consultations and specialists and those things are covered, not all the way down, are covered up to 100%. Remember that 100% is the agreed rate between Bestmed and the specialist. So should Bestmed pay 6,000 Rand, say, to remove an appendix, and the specialist charges double that of 12,000 Rand, you will be liable for the difference between that, and that is where gap cover comes into play. So if you don't have a gap cover, please reach out so that we can get that sorted for you. You do have cover for maxillofacial surgery as well as dental and oral surgery, and it's good to know that you can do things like wisdom teeth, etc. on this option. Small benefit for prosthesis, but it is covered. Certain prostheses are covered, which is great. You do have your internal prostheses. That's what we spoke about just now. Just know that there are certain sublimits that apply. So you can only use 61,000 Rand for pacemaker of this 99,000 that's available. So just know that. And then you've got a benefit for external prosthesis. That's great. So 25,000 Rand. Just know that if you need an arm or a leg or something like that, 25,000 Rand might not be enough. And external prosthesis is not something that you can cover from a gap cover. You can, however, claim this from a gap cover should those amounts not be enough. There is an exclusion on this option, and that's for major joint replacements. So hip, knee, and other minor joints aren't covered on this option. This option is for younger families and not necessarily for people who need hip and knee replacement. So just keep that in mind. Your blood tests are paid, your x-rays are paid, and then your specialized diagnostic imaging is paid as well. As with Bestmed's other options, cancer is covered in full, but you need to register for an oncology treatment plan. If the treatment that your oncologist prescribes is not covered on Pace 1, you can upgrade to any option within Bestmed for within the next 30 days. So very, very nice. There's a lot of benefits with this option, things like midwife assisted birth, which is very nice. Please also take note that mammary surgery, there's no benefit for reconstructive surgery. So on the non-affected cancerous breast. So should you require a reconstruction, that would be for your own pocket, but certain gap covers also pay for that up to a set Rand amount. So great thing to have a gap cover with that. You do also have your palliative care, and then certain procedures that's covered at a day hospital. Just make sure that there might be designated service providers for the hospitals or the specialists. You also have your international travel cover, so make sure where you are going and for how long, and that is in check and in place. So the out-of-hospital benefits, this is definitely where this option shines. For a single person, you have a medical scheme benefit of 12,000 Rand, And for a family a member plus one, so for a family, you've got 24,000. But this is only your day-to-day benefit, your scheme benefit. What you will have on top of this is your savings benefit, which I'll get to in a little bit. So for your GPs and specialists, the first amount will be claimed from your savings. And once your savings has been depleted, it will switch over to a benefit of either 2,400 or 4,900 that you've got for consultations. And this is a sub-limit within this overall limit. The same applies for your dentistry. It's savings first. Once your savings have been depleted, you've got 4.5 or 9,200 Rand, subject to your overall limit. So just take note of that. Again, for medical apparatus, so those are crutches, moon boots, wheelchairs, things like that, you've got 12,000 Rand, but savings first, and it is also subject to your overall day-to-day limit. You also have a benefit for hearing aids, and this is 8,800 Rand per family every 24 months, and it is subject to pre-authorization. So that's a standalone benefit, very, very nice. You do have a great benefit for supplementary services. Supplementary services are biokineticists, physiotherapists, chiropractors, psychologists, homeopaths. There's a whole list of people that are paid from this benefit. And remember, savings first, and once that's depleted, it comes out of your scheme benefit. You also have wound care that's available, so that's very, very nice. Then you've got an optometry benefit. So they pay, if you go to a PPN network, you've got a higher amount that will be paid, so always make sure that you use the correct network. They pay for one consultation, a frame up to 1,000 Rand, the full cost of single vision, bifocal or multifocal lenses, or you can get contacts for 1,840 Rand. If it's a non-PPN provider, the same benefits apply, but they'll pay it at a reduced rate. Very nice. This is an add-on benefit. It is not subject to your overall limit, and it's also not subject to your savings. It will come from your optometry benefit directly. Your radiology, savings, there's now x-rays and blood tests. It will be savings, and then your scheme benefit. MRI and CT scans, again, this is additional benefit. It's not subject to your overall limit. You've got 16,000 Rand for your family. And then let me just change my color here. Just take note of this. If you go for an MRI scan out of hospital and it's 10,000 Rand, Bestmed will pay this on Pace 1 in full. If you go for a second scan and it's 10,000 Rand again, Bestmed will pay the 6,087 Rand that's left, and you will have to pay the difference of 3,913 Rand, if my maths is correct. This will be claimable from your gap cover. So your first claim will be paid in full, your second claim partially, and then that will be covered from your gap cover. Your third claim, because Bestmed won't pay anything, the benefit has been depleted, you also cannot claim from your gap cover. So just make sure you know how that works. Medicine, you have your normal chronic conditions. If you don't use the formulary, you can have a co-payment. You've got 7 additional conditions. We'll stop there now, covered at 90%. Also, if you don't use the formulary, there's 25% co-payment. Here you have 7,000 Rand and 14,000 Rand for family. This is not subject to your overall limit, but a chronic benefit, so it's an additional benefit. You also have acute medicine, and this again is savings first, and then it's subject to your overall limit. And the overall limit that I keep on referring to is this amount that we spoke about in the beginning. In other words, two things can happen here. If you're a family and you've used 24,000 Rands day-to-day benefits, remember, not for your standalone benefits and also not including your savings, only on your scheme benefit. If you've utilized 24,000 Rand, you don't have any other scheme benefits left. But you can use all of your doctor's visits as an example, and then you still have 19,000 Rand left for auxiliary services or dentist or whatever else. So, but then you don't have consultations anymore. So you can exhaust a specific benefit or all of your day-to-day benefits. Your additional conditions is acne, ADD, and ADHD, allergic rhinitis, eczema for severe eczema, and then migraines, gout, and major depression. This is a great benefit because most options or medical schemes will cover bipolar, but not necessarily depression. So that's a great benefit to have on them. Okay, then your preventative benefits, you've got flu vaccines, pneumonia, travel vaccines, pediatric immunizations, excellent benefit because they can be very expensive. Baby growth development assessments, female contraceptives, so they pay for 2,550 Rand contraceptives. And then a new benefit that's been added on this option is that if you want to use a IUD, those are devices that's medically inserted, and this is almost not a permanent contraception, form of contraception, but it is contraception where you don't have to take tablets or injections or patches, and it usually lasts for up to 5 years. The device will be paid from this 2,500 Rand, and then the procedure to insert the device will now be covered by Bestmed as well. In the past, this came from your normal day-to-day benefits. They also have your back and neck program to prevent surgery, so that's great. And then you've got preventative dentistry, we'll get there now, mammograms, PSA screenings, HPV vaccinations, and pap smears. Just make sure of the age that you have to be for this, and then also make sure of the frequency that you can go for these tests. Also take note that your PSA screening and like a pap smear, for argument's sake, the benefit covers the pathology test, and the doctor's consultation to do that test would either be paid from your savings, available day-to-day, or your own pocket. So this benefit is only for the tests itself. Okay, once you've done a health assessment, that's doing all of these, you get one face-to-face fitness assessment at a tempo by kineticist, so that's very nice, and then face-to-face nutrition assessment with a tempo dietitian, and then the follow-ups are virtual, so that's very, very cool as well. You do have maternity benefits, a great benefit, 9 antenatal consultations, that's before birth, 1 postnatal consultation, 2 2D ultrasounds, and some supplements, and on top of that, you also get the pediatric immunizations and that baby assessments in the first 2 years. So that's very, very nice. Preventative dentistry, under 12 years or above 12 years, you can go once a year for a consultation. Under 12 years, you can go twice a year. So that's great. That's the difference in terms of age. And then the full mouth intraoral radiographs, all ages, once every 3 years. Again, you've got those photos, 2 photos a year, scaling and polishing twice a year for everyone, fluoride treatment twice a year, and then you've got some other benefits there as well. And that's it, ladies and gentlemen, for Pace 1, an excellent option. If you've got any questions or want to find out more about gap cover or about this option, there are links below where you can click to either schedule a meeting with us or to request a quote. Please make use of it, and we'll reach out to you soon. Have a great day. Bye.